What if your heart could squeeze normally, but still couldn't fill with enough blood? That can happen with a rare condition called restrictive cardiomyopathy. Unlike some heart conditions where the heart becomes weak or enlarged, restrictive cardiomyopathy makes the heart muscle stiff and less flexible. And that stiffness can prevent the heart from filling properly. So what causes it? What symptoms should you watch for? And how is it treated? Let's find out. Welcome back to Heart Lifelines. Today, we're exploring restrictive cardiomyopathy, a condition that affects the heart's ability to relax and fill with blood. We'll explain what happens inside the heart, the possible causes, warning signs, diagnosis, treatment, and why recognizing the condition early matters. What is restrictive cardiomyopathy? Think of your heart as a pump with 4 chambers. Before each heartbeat, the heart needs to relax and fill with blood. Then it contracts and pushes that blood throughout your body. In restrictive cardiomyopathy, the heart muscle becomes stiff or less elastic. The heart may still be able to squeeze relatively normally, but it doesn't relax properly. That means the chambers can't fill with enough blood. As a result, pressure can build up inside the heart and the veins leading back to it. Over time, this can cause blood to back up into the lungs or other parts of the body. So even though the heart may not look dramatically enlarged, it can still struggle to meet the body's needs. What causes it? Restrictive cardiomyopathy can have several different causes. Some cases are related to conditions that cause abnormal substances to build up inside the heart muscle. These may include inherited genetic conditions, amyloidosis, where abnormal proteins can accumulate in tissues, hemochromatosis, which can cause excess iron to build up in organs, certain infections or inflammatory diseases, previous radiation treatment involving the chest, other diseases affecting the heart muscle can also cause restrictive patterns. And sometimes, despite extensive testing, doctors cannot identify a specific cause. Because the causes can be very different, doctors need to look at the person's overall health and medical history. Symptoms. The symptoms of restrictive cardiomyopathy often develop gradually. Some people may initially notice that they become tired more easily. As the condition progresses, symptoms can include shortness of breath, especially during physical activity, fatigue and weakness, swelling in the legs, feet, or ankles, heart palpitations, dizziness or lightheadedness, reduced ability to exercise. Some people may also have difficulty breathing when lying down. These symptoms can occur with many different conditions, so experiencing them doesn't automatically mean someone has restrictive cardiomyopathy. However, persistent or worsening symptoms deserve medical evaluation. Why can it be serious? If restrictive cardiomyopathy becomes severe, it can lead to complications. One major concern is heart failure. Because the heart cannot fill normally, the amount of blood pumped to the body may become inadequate. Pressure can also build up behind the heart, causing fluid to accumulate in the lungs or lower parts of the body. Some people can also develop abnormal heart rhythms, known as arrhythmias. In certain cases, blood clots or other complications can occur. The seriousness of the condition depends greatly on its underlying cause and how advanced it is. Diagnosis. Doctors may use several tests to determine whether someone has restrictive cardiomyopathy. These can include electrocardiogram or ECG echocardiogram, which uses ultrasound to examine the heart, cardiac MRI, which can provide detailed images of the heart muscle, blood tests to look for underlying conditions, genetic testing. In certain situations, doctors may also perform additional tests depending on the suspected cause. Treatment depends heavily on what is causing the restrictive cardiomyopathy. Doctors may use medications to manage symptoms such as fluid buildup, abnormal heart rhythms, or high pressure within the heart. If an underlying disease is responsible, treating that condition may help prevent further heart damage. Some people may need devices or procedures to manage serious rhythm problems. In advanced cases, specialized heart care or a heart transplant may be considered. Because treatment is highly individualized, working closely with a cardiologist is important. Restrictive cardiomyopathy may be uncommon, but understanding how it affects the heart can help you recognize why symptoms like unexplained shortness of breath, swelling, or extreme fatigue shouldn't simply be ignored. Your heart works for you every second of every day. Taking a few minutes to learn about it today could make a difference tomorrow. Thank you for watching Heart Lifelines.